For my ethical dilemma, I chose to write about a patient's right to know their diagnosis and withholding important medical information from patients. Long regarded as the father of modern clinical medicine, Hippocrates once encouraged physicians to conceal most things from the patient while attending to him, to give necessary orders with cheerfulness and serenity, and to reveal nothing of the patient's future or present condition. Until recently, the physician has assumed a paternalistic role in which he or she would make decisions for the patient based on what was deemed in the patient's best interest. Prior to the 1960s in North America, the standard practice was to not reveal a cancer diagnosis to a patient directly and to bend the truth in an attempt to keep the patient calm and to avoid any stigma that may be associated with what was, at that time, considered a fatal disease. The paternalistic approach that was taken in the early days of modern medicine prioritized the more traditional values of beneficence and non maleficence. During the 1960s and 1970s, however, there was a shift toward full disclosure that can be attributed to patient demands for consumer rights to information, in addition to the rise of laws mandating informed consent for patients. Disclosing important information is the primary purpose of informed consent, and informed consent is an essential element of the principle of respect for the patient's autonomy. The purpose of informed consent is to ensure the protection of patients for any sort of misinformation, manipulation, or pressure, and to enable the patient to determine what they believe is in their best interest. Contrary to what was thought in the past, studies have revealed that patients do want those caring for them to reveal the truth about their diagnosis, prognosis, and therapy. In today's world, paternalism has given way to truthfulness and open communication between a healthcare professional and the patient, and is the standard of care in the United States. Healthcare professionals are more likely to consider the ethical values of fidelity, justice, autonomy, and veracity, which are driven by the idea that patients should be able to exercise their rights to give voluntary, informed consent after receiving full disclosure of important medical information. The current view is that withholding important information in the belief that the information will harm the patient in some way can create a conflict between the healthcare professional's responsibility to promote the welfare of the patient and to respect the patient's autonomy. Patients put a great deal of trust in those who are responsible for their healthcare, and when healthcare professionals communicate with their patients, they are in turn promoting that trust and showing the patient that they respect them. Some may argue that there are situations in which truth-telling may negatively impact certain patients. Families might ask that healthcare professionals withhold a serious diagnosis, such as a terminal prognosis, from a patient, and these families may try to justify such requests by stating that they want to spare their loved one from such difficult and painful news. Often the request is unsubstantiated, and the family is reassured that the news will be delivered to the patient in the most sensitive way possible. On the other hand, there are instances in which it is believed that this request is justifiable. If a physician has evidence that revealing a prognosis could cause harm to the patient, the disclosure of the information may be withheld. For instance, if a patient is suicidal, depressed, cognitively impaired, or simply requests that the information be withheld, the decision to withhold information from the patient would be in the patient's best interest. This judgment is often called the therapeutic privilege, and while it is important, this privilege is also abused. For this reason, therapeutic privilege should only be used in cases when the harm to the patient is evident and not simply assumed. The rationale for invoking therapeutic privilege is that disclosing the information would pose a serious threat to the patient, and the principles of beneficence, to do good, and non-maleficence, to do no harm, would outweigh the principle of the patient's autonomy. Another topic of ethical consideration for healthcare professionals working in the United States is the cultural diversity within the country and the various differences within each culture that affect the view of truth-telling. In some cultural societies, it is the child's responsibility to protect his or her parents from upsetting news, while in others, the provider informs the family before telling the patient. Cultural considerations add an additional ethical challenge for healthcare professionals in America, as does the fact that these cultural norms aren't always accepted by every family member. Older generations may participate in the practices of their home countries, while younger generations embrace different views. According to the American Medical Association, there are several aspects that should be considered in respect to disclosing or deciding to withhold information from patients. Some of these aspects include encouraging the patient to specify preferences regarding communication of medical information before the information becomes available, honoring the patient's request to not receive certain medical information, assessing the amount of information the patient is capable of receiving, consulting the patient's family or ethics committee for help in assessing the benefit or harm associated with delaying disclosure, monitoring the patient carefully, and offering full disclosure when the patient is able to decide whether to receive the information, and disclosure of medical errors if they have occurred in the patient's care. When examining this ethical dilemma, one must take into consideration the consequences of telling the patient the truth, as well as the repercussions of choosing not to. Healthcare professionals as a whole are expected to tell the patient the truth at all times, simply because it's the right thing to do. Truthfulness correlates with respect for a patient, shared decision-making, and patient empowerment. Truth-telling allows the patient the positive benefits of being well-informed, and those who are well-informed tend to seek treatment and cooperate with healthcare professionals. When a patient knows their diagnosis and prognosis, they are able to seek other opinions, plan their care, and are more capable to tolerate both the treatment and the pain that accompanies it. When a patient lacks full disclosure, they are less likely to seek treatment due to not knowing the full extent of their illness, which could ultimately result in harm. It is argued that if a patient discovers that they have been deceived by a healthcare professional, they will be much less likely to trust them in the future, and as a result, will be less likely to seek treatment. Psychologically speaking, not knowing a diagnosis would be more likely to cause the patient unnecessary worry about the unknown due to the fact that the patient is unable to reveal fears and worries and may remain anxious and thinking the worst. In addition, it is believed that not informing patients of their illness will ultimately deprive them of a good death. Ethical dilemmas often arise in the healthcare setting and can create tension and debate among patients and their families, as well as among staff members. The American Nursing Association Code of Ethics acts as a non-negotiable standard that outlines the obligations nurses have to patients and to the profession, and can also be used as a guide for nurses to navigate ethical dilemmas in the workplace. There are many variables within the Code of Ethics to consider when examining the ethical dilemma of a patient's right to know important medical information. The first provision to consider is the respect for human dignity. Nurses have a duty to respect a patient's right to self-determination when planning and providing care. The nurse is responsible for ensuring that a patient is fully informed with the necessary information and equipped to make decisions about their own health care. The second provision is to consider the nurse's commitment to the patient. Nurses should always remember that the primary responsibility is to the patient and should strive to advocate for them. The third provision that I feel is important is to consider the protection of the patient's rights. Nurses should always be aware of both the legal and moral responsibilities that are related to the rights of patients. I think this is an ethical issue that healthcare professionals likely deal with on a regular basis. The patient's desire to know or ability to understand, the family's involvement, and the cultural aspects are all very complex issues that have to be considered by the healthcare team when dealing with this ethical concept. Ultimately, I think veracity and autonomy are of utmost importance. Nursing professionals are trained to keep the patient's best interest in mind at all times, and this includes giving the patient the right to make healthcare decisions for themselves. For this reason, I believe that the truth should be offered to the patient. But at the same time, I can agree that truth-telling may not always be the answer in every situation. In the case that a patient is suicidal or suffering from cognitive impairment, I agree that upsetting news may not be in their best interest. Generally speaking, however, I do think that it's important that a patient is informed of their medical diagnosis and prognosis should they choose to know, so that they are able to make the necessary decisions for their future care.